Hello, everyone, and welcome to today's webinar, Updox and STRAND, Linking Pharmacists and Prescribers to Improve Heart Health. We appreciate everyone taking time out of your busy schedules to attend our web seminar, so we will go ahead and jump right into today's content. So first, I'd like to start out by giving you all an idea about the sequence for the content so that we know what to expect. So first, we'll walk through the presenter, of course, Mr. David Pope. Then we will go through the problem, the pathway, the STRAND and Updox relationship. Then we will go into direct secure messaging and some of the details around that, care coordination, the Updox difference, how you can get more information, and any Q&A that you might have. If you have any questions during the webinar, please feel free to type it into the chat function of GoToWebinar. So I'd like to introduce today's guest speaker, David Pope. He is pharmacist, chief of innovation, co-founder of STRAND, formerly known as Creative Pharmacist. David, whenever you're ready.
Great. Well, thank you so much, Megan, for organizing this today. Grateful for you to take the time as well as pharmacists. I'm a pharmacist myself, still practice, albeit on the weekends or holidays these days, but certainly we have seen a movement in practice of pharmacy unlike any other. The majority of pharmacists out there are now saying that the times that we live in today, we are experiencing more change than almost any other that we've experienced in the past decade. And that includes going from, of course, typewriters to electronic communications, again, because we are in a day and age today where the prescription fill itself is part of the equation, but now we're adding new clinical services into that. And as we begin to look at all of the different ways that a pharmacist can impact care, we must take a look at some point at the number one killer in the United States, and that is heart disease. Again, you and I as pharmacists, we're always looking for various ways to be able to impact patient care. Many times, however, that is siloed in terms of what you do versus what a physician does versus what a nurse does or nurse practitioner, all of those different things. But so the goal today is that we might learn a little bit more about new trends, new ideas, utilizing technology, utilizing the power of the pharmacist as well to be able to impact care specifically when it comes to the heart health side. So as we go to the next slide, we'd like to begin by just talking about the problem out there. And as we go to the next slide, we'll see that 1 out of every 4 deaths in the United States today are attributed to heart disease. 1 out of 4. Now, one thing you won't see, to be honest with you, is this being blasted all over news, especially if you watch the 6 o'clock news. For those of you who still do, many of us are still working during that time. But again, if you ever watch the 6 o'clock news, it's filled with drug manufacturer videos and commercials. What you don't see a whole lot of is about this, is about heart disease, because this is a number one killer in the United States. Because again, many of those medications are off patent, they're now generic, but yet and still 610,000 people die of heart disease every single year. That's like taking one of the largest stadiums in the country. That could be, for example, my beloved Georgia Bulldogs, and again, their football stadium, which houses over 96,000. You have, of course, the Ohio State Stadium. All of those, basically taking 6 stadium full alone and showing that as those are the number of people who will die every year from heart disease. Now, how do we change that? And how can we move that along? Well, it's really a specific pathway that's, again, that's broad reaching. It's not one thing that can affect heart health. It's many things. And the one thing that we do know is that they need a guide. A guide is, again, if we were to be climbing a mountain in certain parts of the Orient, we might call you even a Sherpa. A guide is one who can guide along, bringing the right tools at the right time so that they can achieve a goal. That goal for the Sherpa is to be able to climb to the top of a mountain. And you and I as pharmacists have a goal as well, and that's to improve overall health. Not only that, but prescribers are beginning to notice and beginning to send patients there to specific pharmacies based off of how they affect patient care, as well as we're seeing payers get involved as well in being willing to pay pharmacists for the impact that they are making on their patient lives as well. So what is that pathway? The first is to engage your patient in a new way. Again, apart from the prescription filling process, there is an engagement that occurs with the patient. Many of you, for example, are providing medication synchronization services. And so, again, you're syncing those meds up. They're coming in at a specific time each month. And the goal of that is to leverage that moment in time that you might be able to affect patient care. Again, some of you are even offering a specific appointment at this time, offering the appointment-based model. Makes sense to me because our goal is no longer just to say, are the drugs right? That's more of an MTM type thing. But now we're trying to determine, are the medications effective? And so therefore, we need education. We need clinical assessments such as ASCVD risk, or again, so many different things. If you are on a blood pressure medication and you are, let's just say, over 45, there is a strong chance that you may also have prediabetes. And so how can we assess for that? Through screening. So many different things to be able to determine, is the drug effective? And then also, there needs to be a pathway where you can not only keep this data to yourself, the blood pressure that you've taken in your pharmacy to stay with yourself, but you also need to be able to, and we as collectively need to be able to share that with the rest of the healthcare team, because again, it is in the physician's best interest to be able to partner with you. They are now, just so you know, being measured just like you and I are. There's a different pathway for that. They have something called MACRA and MIPS, where you and I have star ratings. But the end result is the same. How are you affecting care? And they're wanting to pay based off of quality. So you can imagine now that physicians are under the same roof as you and I are as pharmacists, and that quality now makes a difference in payment. Again, why wouldn't they decide to send a patient to you, whereas they might have said, you know what, I can't really send a patient to a particular pharmacy. Well, now they're sending to you for a specific clinical service. And again, one of the great things that we've seen in the marketplace is even Medicare get behind this and say, again, we agree. There's no steering that occurs whenever you are sending a patient towards quality. And that's what you are providing as an independent pharmacy through STRAND and through Updox. So care coordination is now a standard of practice in every way. So let's talk a little bit about the tools that you have within STRAND. So as we go to the next slide, you'll see here where we have a one-on-one education track. When you meet with your patient, you can use STRAND to be able to engage your patient with education. Now, as a side note, don't forget that STRAND has single sign-on capability with the majority of the marketplace. I get it just the same as you do, that it has to be within your workflow. If we're going to engage our patients, it has to be in that workflow. And so, again, if you are in systems such as Computer RX, RX30, Pioneer, McKesson's systems, the list goes on and on. You have the ability to be able to be in your pharmacy workflow. And whenever it's time to do clinical things, you can, with one click, log into STRAND without even actually logging in. We'll log in for you on the back end to where it's all built in within your pharmacy management system. If you're curious about whether your pharmacy management system connects with STRAND, chances are it does. But again, feel free to reach out to us and we'll give you our contact information at the end. So that way, you're in workflow, you fill prescriptions, and the patient it comes in the door because you've synchronized their medications. It's time to do clinical things. With one click, you can pull up that patient chart, and the education is built into that patient chart as well. We have one-on-one education tracks on heart health, on heart failure, diabetes, prediabetes, smoking cessation. The list goes on and on. But specifically for heart disease, we have a one-on-one education track you can teach your patients with, as well as if you say, you know what, I'm not going to do that, but I'd love to offer maybe a group class as well once a month. We write that every single month for you as well. We even give you the words to say in the discussion. We attach that to video to where you can use that as an accompaniment. We have the patient handout, all to where you can make a meaningful impact. If it's one-on-one, it's going to be quick, again, because we've got to get you back into the workflow. But you can teach your patients on diet, on exercise, on care coordination, on the medication, and it's all built in. You don't have to go try to find a system. You don't have to go back and search a Dropbox file or maybe even a filing cabinet to find those educational pieces. It's just all done and ready and waiting for you. Now, again, if you'd like to make a scheduled appointment with this patient, you can certainly do that. Many of our pharmacies are using this because they're also billing for clinical services, which we'll talk about more in just a moment. Those clinical assessments, such as risk calculators, again, are built into STRAND as well. So, again, if you're not sure which kind of assessment to provide, we'll actually tee that up for you in our recommended interventions section as well, so that you can document not only is the drug right, but is the drug effective. Those assessments you might be assessing the medication regimen as well. Just know that we can document drug therapy problems and the like, and we can actually send that to any electronic health record in the country, actually through our partnership with Updox. What a great way to be able to do that. Now, within heart disease, there is undoubtedly these specific things on the patient side, some action items that they need to do and perform as well. And so certainly you have the ability to be able to document goals and whether they've achieved those goals. So it might be something totally non-medication related, such as a diet or an exercise goal. And you can certainly document that. For those of you who are interested in billing, for example, with diabetes education, that's a requirement, by the way. And so that's just all built into the platform so that you can document. And as you walk away from your patient, you can walk away from your documentation and your billing at the same time. So no more sitting afterwards for an additional 15 to 30 minutes to document. And then, honestly, the billing portion hasn't been around. And so we're excited to be able to bill insurances in multiple states as well for this. Actually, we bill in every state, just so you know, for clinical things, such as diabetes education, pre-diabetes education. If you live in the state of Missouri, there are multiple opportunities for you as you're billing for asthma education. You're billing for a risk reduction program. If you're in the state of Washington or California or Tennessee, again, in multiple states now, even Oregon, you are now able to bill for many things, including office visits. Just like your physician would, you can bill with anything for anything in your scope of practice. STRAND allows you to be able to do those things. And so if you are looking for an alternative revenue stream, apart from perhaps OTC items and things like that, if you want to bill for clinical things, STRAND is the platform out there. On the inner circle there is a very specific thing there that says we should be collaborating and communicating, not just documenting, but we've got to be able to share this data as well, because that's truly what results in patient-centered care. And so therefore, that's why we are proud supporters and partners with Updox, because they allow for the collaboration and communication of whatever you document in the STRAND platform can be communicated to any of the electronic health records and any of your physicians and healthcare professionals in the area. So as we go to the next slide, again, excited to talk to you today about reporting. Again, as you begin to develop all of these things, you begin to document all of these things, there has to be something else out there. What else can we utilize this data for? If you're meeting with a patient in STRAND, you're documenting the clinical things, you're educating them, and that's teed up for you through STRAND. You are documenting a blood pressure every single time. You're communicating that to the rest of the healthcare team through care coordination. You know what? You're assessing the patient. You're doing all of those things. But what else could we do? And I just wanted to take a moment just to say that we are seeing a movement across the country of pharmacists who are dedicated to this type of model begin to take matters into their own hands and saying, you know, if I'm going to make an impact on my patients, I'm going to tell my own story. And I'm going to be able to say that I'm not just unique and I'm just an independent pharmacy, but I'm uniquely better and I can prove it. And so, for example, the patients coming in my pharmacy they meet their goals for blood pressure of less than 140 over 90, 85% of the time. The national average is 75. The majority of my patients have a weight drop of 13 pounds. The majority of my patients who come in the door are meeting their goal for A1C. The list goes on and on. And so I just want to say, again, there are times when we're able to bill for these clinical services. In fact, we're the #1 pathway in the country for that now. If you're billing for clinical services, chances are you're probably doing it through STRAND. But at the same time, I can't help but just be excited about the fact that by pharmacists documenting in STRAND, we are able to turn around and help tell the story for clinical services and the impact that you are making. And we're already seeing this making a difference on the drug side. Again, whereas perhaps your PSAO, that's the group that comes and barters on your behalf for clinical services, for prescription contracts for insurances. They've gone to insurances and saying, hey, look, we've got a great network of 2,000, 3,000, 4,000 pharmacies, and we just really want to, we are available, and we can service your customers. And yet and still they're being turned away and saying, well, we're going to cut you by another 5% this year. There is an impact that's being had now that whenever you're in those types of meetings, that if you are able to prove your value, not just on the drug side, again, gone are the days also are just saying, hey, we do adherence packaging, or we can sync meds, or our adherence is better. They're now looking for end results. And so we can actually show that through next level reporting, where we can show the clinical impact that you make. Such as what you see here. We can translate that even to the language of healthcare and the language that and the measures that insurers or payers also are judged by. Those are HEDIS measures. What a great thing it is, in my view, to see pharmacists going into meetings for new opportunities with insurers, and they're sliding this type of data across the table and saying, before we talk, I just want you to know that we've enjoyed handling and meeting with your patients. That you're covered lives as a payer on a consistent basis. And let me just show you the impact that we're making on your patients right now. Again, it shows value and that you are uniquely better. And I'm just proud to see that the vast majority of the time, I'm talking, again, over 90% of the time, that the impact of the pharmacist on patient care is palpable, specifically with heart health or diabetes or COPD, those things that cost the healthcare system the most dollars. So as we go to the next slide, there are, again, billing opportunities for you. We have built medical billing or physician-style billing directly into STRAND. So if you would like to bill for a clinical service, if you're in the state of Virginia and you want to bill for opioid abuse prevention education, we can do that for you. If you're in the state of Pennsylvania, they have, first of all, the Enhanced Service Network there. The CPESN has selected STRAND to be able to document all of their clinical services. You have unique opportunities just for you through STRAND. You also have the ability to bill for tobacco cessation. If you are in the states that have oral contraceptive writing capabilities, such as, again, I think about Oregon or Colorado or, Maryland, the list goes on and on, where you are able to now document and bill for oral contraceptive therapies, right for that, and you can actually bill for that. By the way, it's really cool. We've had pharmacists now who are prescribing now in multiple states, and they're doing that through STRAND. STRAND actually produces the prescription for those pharmacies as well. And so again, the only thing that I would say in all of this is that there also is a need. There is a need to understand what clinical services can be billed in my state and for me personally, as well as how do I get there? How do I get through a contract? How do I get a contract? And what is credentialing? What does that mean? And how do I get through that? We have something called the Proclaim pathway that guides pharmacists through the credentialing and contracting phases and helps you to be able to bill directly within our system. Again, this is not a paper-based system by any means. This is STRAND has built what the electronic health record has done for physicians. We do for pharmacists. You are able to bill for clinical services all within our system. And it's all electronic, it goes directly to the insurance. And so, in fact, it's electronically adjudicated, just like your prescription side, except it's physician style. Totally different road, but we bring you access to those things. So as we skip to the next slide, the last thing I'll say is just there is a need to connect all that you do to a prescriber. You can imagine if we were billing for point-of-care testing, one of the great things that you can do within assisting patients living with heart disease is to share what you know. Part of that is certainly in point-of-care testing. And so the idea is to connect to prescribers. And the great thing that we have is that we have built-in technology to be able to do that. That is Updox. Our integration with Updox allows us to be able to connect and communicate with prescribers. That's everything that you document. That might be clinical findings, drug therapy problems, adherence, the education that you teach, you name it. We have that ability through the power of Updox to be able to share and deliver what you do within STRAND. So with that, again, as we go to the next slide, would love to introduce you. Again, turn it back over to Megan, again, and Janelle. Again, excited to be able to share what Updox does within the system as well. So Janelle, I'll turn it back over to you.
Perfect. Thank you so much, David, for that fantastic presentation that gave us really great takeaways to consider when treating our pharmacy patients with heart disease or heart-related illnesses. You are a hard act to follow, but I'm going to do my absolute best. So again, my name is Janelle Aiden. I am the product manager for pharmacy here at Updox. So I would like to continue the presentation with specific info about Pharmacy Connect and dive into some of the specifics on what the platform entails. So what's Updox, or who are we? So we are an industry-leading communication platform for independent pharmacies, and we were founded in 2009 by healthcare professionals. So we've partnered with STRAND alongside the other major pharmacy management systems to extend our reach into community pharmacies. We're also integrated with over 100 electronic health records, and this creates a space where healthcare professionals in different sites of care can communicate securely, because we recognize that this was not an option that existed before. So we are in the business of simplifying healthcare because we know that the industry can't really function properly without it. So we've positioned Updox Pharmacy Connect to focus on you as independent pharmacists to make this communication within the healthcare system as seamless and efficient as possible. So in a nutshell, as you can see here on the screen, we are a HIPAA-compliant care coordination suite. So securely exchanging clinical records with prescribers, eliminating manual processes, engaging patients, and fitting right into your workflow. This is everything that we aim to bring to you through Updox. So direct secure messaging and care coordination, diving into this a bit. So with our direct secure messaging, we just heard from David in that fantastic presentation that heart disease is the #1 global cause of death. And in order to effectively engage your patients and their family members and any sort of caretaker, it's crucial that your pharmacy has the right tools to communicate effectively and in a productive way. So one of those ways is with direct secure messaging. In this directory, there are over 1 million direct secure email addresses through Direct Trust. And Direct Trust is a nonprofit alliance that creates and maintains the standards for these direct exchanges. They provide a secure encrypted network with thorough accreditation processes. And the thought behind direct messaging is to make sure that exchanging health records and information is easier between different sites of care. And as David also mentioned before, this fits directly into their Macro MIPS initiative and the prescriber workflows. So it's really focused on that transition from paper-based to electronic healthcare records, or EHRs. You'll also be able to communicate with them, like I said, in a HIPAA-compliant way, because we know that protection of PHI is a priority. And Updox is the second largest healthcare information services provider, or HISP, in the country. So This allows us to offer those direct secure email addresses to our users and any other healthcare provider that you may refer through our system, allowing you to communicate securely in an email format back and forth. Direct already supports the secure transmission of the plans between direct secure users. So it provides the communication framework for pharmacists, prescribers, and any other sort of care provider to share that clinical information, especially the pharmacist e-care plans. So care coordination, the basic flow of care coordination with Updox and the STRAND relationship would look something like this in the simplest way. The prescriber would send maybe the CCD clinical summary before an initial visit, done through our direct secure messaging or electronic fax. Then you as the pharmacist would share that clinical finding of the e-care plan after the visit. So to the prescribers and care teams, you would again use that direct secure messaging or secure electronic fax. And to the patient, you'd be able to send it to them within HIPAA compliance through a patient portal online. So again, this really just makes it easy to exchange vital information when you don't want to risk violating any sort of HIPAA laws. So as with any company and any partnership, we are constantly striving to be the best version of ourselves, which results in enhancements, of course. So I would like to highlight a couple of key features that we consider the Updox difference that really make us stand out, especially in our partnership with STRAND. So this first lies in the ability to manage all types of communications between those different sites of care and the associated documents, which also includes the ability to filter and effectively target the patients and prescribers you want to reach. And it's all within one consolidated inbox that houses everything into one central location. Also all customizable according to your preferences and settings in your pharmacy. We also offer electronic faxing and document management, SMS text messaging to prescribers or patients, custom online forms, and of course, direct secure messaging. So again, just two that I really wanted to pull out of there. So the first is electronic fax. This automates your administrative tasks that you and your staff likely do every day. So we like to say that you can get rid of that clunky fax machine. The goal here, of course, is to reduce the paper that you're using, extra expenses with phone lines or any hassle that's associated with traditional fax. You can see here that this is a live version of what you would see if you were to receive a fax and maybe edit it within the Updox STRAND platform. So you'd be able to highlight, you'd be able to break apart, rearrange, add, delete pages as necessary, customize it to however you need, and send it directly out to the prescribers or any other healthcare team as you see fit. Again, as you guys evolve, we know that we must evolve with you. I don't know one single person that does not have some sort of cell phone or smartphone. So our newest enhancement is SMS Quick Send Text Messaging. And your pharmacy will be given a dedicated phone number where you will be able to send and receive SMS text messages from your patients or prescribers who have cell phone numbers in your pharmacy management system. So uses for this kind of include texting patients for delivery notifications, maybe if you wanted to remind them about a refill, if you know them personally, appointment reminders, or even maybe texting prescribers for quick questions. This functionality also includes threading, so you'll be able to go back and see what you've been communicating with your patients or prescribers, able to track entire conversations. Especially concerning patients with heart disease, if your pharmacy offers any sort of special education sessions, wellness trainings, or any other specials that would really benefit them, this would be a great way to follow up for those patients or their family, and you'd have a chance to text them really quickly and have it land right back into your Updox STRAND inbox. So again, the Updox STRAND partnership allows you to elevate your pharmacy to optimal efficiency, effectiveness, and productivity. Ultimately, easy communication is what we're here for, and we want to make it easy for you to interact with prescribers and your patients, get your questions answered, and avoid wasting unnecessary time. Of course, enhancing that prescriber collaboration, eliminating those paper processes, engaging patients online, especially through the portal, and driving that clinical services revenue that David so eloquently put earlier in the presentation. So to finish out here, a special offer that we'd like to give you all for attending today's webinar is if you were to sign up for Pharmacy Connect and of course STRAND by April 30th and you can receive 50% off for 1 month and free training. So what that looks like, there's no contract, so if that 1 month is done, there's no need to pay for an entire year, no hardware, and of course free support at all times. Thank you so much for attending, and I hope you all have a great day. Thank you so much, David, for that fantastic presentation.
Thank you as well. Thanks, everyone.